Hello, everyone. Today we will discuss a topic that plays an important role in all of our lives. By watching this video, you will better understand how excess weight affects our health in 10 steps. There are some facts that many of us do not know, and how obesity affects not only our physical health, but also our mental health. Don't forget to watch the video until the end. If you like our video, you can subscribe to the channel and like the video. Let's start. Step 1. Heart diseases. Obesity triggers various heart diseases. High blood pressure, high cholesterol, type 2 diabetes, and other metabolic problems are side effects of obesity. Excess fat in the body makes us bloated from the inside and causes inflammation. This causes fat to build up, causing blockages in the arteries. As a result, the risk of heart attack or stroke increases. Moreover, obesity also damages the heart muscles. Excess fat in the body causes the heart to work harder. This can cause the heart muscle to enlarge and increase the risk of heart failure. Additionally, obesity can cause breathing problems during sleep, leading to a condition called sleep apnea. In this case, breathing may stop or decrease during sleep, which negatively affects heart health. Step 2. High blood pressure. Obesity creates an extra burden on the heart and vascular system. Excess fat tissue means the body needs to pump more blood, which can lead to an increase in blood pressure. Additionally, obesity can increase inflammation in the body and reduce the elasticity of blood vessels, further raising blood pressure. It's important to note that high blood pressure is not solely attributed to obesity. While obesity increases the risk of high blood pressure, other factors such as genetic factors, stress, salt intake, and lack of physical activity also play a role. It's crucial to recognize that high blood pressure can lead to serious health problems. It's associated with complications like heart attacks, strokes, heart failure, and kidney failure. Therefore, controlling obesity and adopting a healthy lifestyle are important ways to reduce the risk of high blood pressure. Step 3. Liver diseases. Obesity is a significant factor that seriously affects liver health. The liver plays a crucial role in regulating fat metabolism in our bodies. However, obesity-related liver diseases often progress silently and may go unnoticed before symptoms emerge. However, they can lead to serious complications in the long run, so reducing the effects of obesity is important. Measures such as balanced nutrition, regular exercise, and weight control can help support liver health. In particular, weight loss plays a significant role in preventing the recurrence of fatty liver disease. Step 4. High cholesterol. As the amount of fat in our bodies increases, cholesterol levels in the blood tend to rise. This is particularly true for LDL cholesterol, commonly known as bad cholesterol. LDL cholesterol can accumulate in the walls of our blood vessels, leading to narrowing and blockage of the arteries. It can also affect levels of HDL cholesterol, known as good cholesterol. HDL cholesterol cleans up bad cholesterol from the body and maintains heart health. However, obesity can lower HDL cholesterol levels, increasing the risk of heart disease. High cholesterol is often a silent condition with no symptoms, so it should be regularly checked. However, the presence of risk factors like obesity can increase the likelihood of high cholesterol. Therefore, weight control and adopting a healthy lifestyle are crucial ways to keep cholesterol levels in check. Step 5. Respiratory problems. Obesity, a condition often overlooked by many of us, actually affects even our ability to breathe. How so? Let me explain. We mentioned that obesity leads to an accumulation of excess fat in our bodies. This excess fat fills the space inside the chest cavity and leaves less room for our lungs. As a result, the amount of air entering our lungs decreases, making it difficult for us to breathe. Additionally, it can lead to respiratory problems during sleep. This condition is called sleep apnea. Sleep apnea is a condition where we stop or reduce breathing while sleeping. This means we're not getting enough oxygen during sleep. Respiratory problems are one of the serious consequences of obesity. Breathing should be a natural process for everyone, but obesity makes this process difficult. Also, respiratory problems during sleep prevent us from resting and can negatively impact our daily lives. Step 6. Joint pains. Did you know? Every extra kilogram circulating in our bodies actually means a burden on our joints. How so? Imagine you have a bag, and every day you add a little more weight to it. What happens? The bag starts to feel heavy, and you feel pain in your shoulders and back. Well, obesity is like adding extra weight to our body's bag. Our joints struggle to carry this extra weight, and over time, pains begin. Especially large joints like knees, hips, and back feel the effects of obesity more. The excess weight in these joint areas puts pressure on cartilage tissues and can lead to wear and tear over time. As a result, joint pains may arise, and we may find it difficult to move. Step 7. Psychological effects. Obesity can affect social relationships. Individuals may encounter negative behaviors such as exclusion or discrimination, which can increase feelings of isolation and loneliness. For example, when a person is teased or excluded because of their weight, they may feel marginalized from society. The psychological effects of obesity can also negatively impact self-esteem. Constant unsuccessful attempts at weight loss or struggling to fit into society's ideal body type can decrease a person's confidence. This can lead to feelings of worthlessness and negative thinking. Step 8. Cancer diseases. Have you ever heard about the link between obesity and cancer? Yes, gaining weight doesn't just affect our appearance, but also creates significant changes inside our bodies. That's how obesity increases our risk of cancer. The increased amount of fat in the body along with excess weight disrupts the whole system. Especially, these fats play a somewhat complex game inside. For one, obesity triggers a process called inflammation. So, our body is like constantly on fire. This fire allows cancer cells to grow and spread more easily. Then there are hormones, of course. Obesity can mess up our hormone balance. Especially in women, increased fat tissue raises estrogen hormone levels. And this can contribute to the development of some cancer types, especially breast and uterine cancer. But it doesn't stop there. Obesity can also increase insulin resistance. So, the body responds less to insulin than normal. This gives a green light to cancer cells to proliferate, unfortunately. Step 9. Type 2. Diabetes. Diabetes is a metabolic disorder where the body can't effectively use insulin, leading to high blood sugar levels. There's a strong association between obesity and type 2 diabetes, with obesity significantly increasing the risk of its development. Excess fat storage can affect how cells respond to insulin, leading to insulin resistance. This means that cells don't function normally, and sugar isn't transported properly to cells. As a result, blood sugar levels rise, increasing the risk of type 2 diabetes. Accumulation of fat around the abdomen can also increase the risk of type 2 diabetes. Fat accumulation in the abdominal region can increase insulin resistance and contribute to elevated blood sugar levels. Since diabetes is a condition where insulin is not effectively used in the body, it makes controlling blood sugar difficult. This can exacerbate health problems associated with obesity. Step 10. Metabolic syndrome. Metabolic syndrome is defined by a group of specific symptoms coming together: high blood pressure, high blood sugar, elevated triglyceride levels, good cholesterol, and increased waist circumference. And these symptoms can arise as a result of obesity. Metabolic syndrome travels alongside obesity because obesity increases fat stores in the body, triggering a series of metabolic changes. However, this story doesn't have to end in a bad way. Healthy lifestyle changes can be the hero of this story. Balanced nutrition, regular exercise, and weight management play a supportive role in reducing the effects of obesity. Remember, healthy living isn't just limited to physical health. It's also about mental and emotional well-being. Don't forget to take care of yourself every day and prioritize your health. If you've subscribed to our channel, we thank you. If you haven't subscribed yet, consider subscribing to not miss out on our other videos about healthy living. Until the next video, take care and goodbye.